Good morning, everyone. Very good to see so many of you here today. And to our guests of honor, Amy Khor, Minister of State for Health and Manpower, and many other things as well. And as well as the members of our NUS Board of Trustees, Mr. Edward De Silva, as well as Mr. Han Phuc Quang. I know that everyone is very busy, and to take time to join us today is something that we really very much appreciate. It gives us very great pleasure to welcome you to this roundtable. It's entitled Aging in Place, How Prepared is Singapore? Question mark. So obviously that opens up all kinds of questions for discussion. This is co-organized, as Victoria said, by the faculty's Singapore Research Nexus, as well as the faculty's Health Cluster. So the faculty has various research clusters, of which the Health Cluster is one of several. The Singapore Research Nexus, or SRN, as we like to shorten things acronyms, is now well into the second year with online resources. So Amy was just asking me what this is, but basically this is the web portal that you could use to search for either articles or research by students as well as academic faculty on any topic that you like by just typing in keywords, and that will bring up sort of resources that you could use in thinking about issues to do with Singapore. So that's one. And we hope to continue to develop this as a unique resource for researchers focusing on Singapore issues. We have also tried to work hard at a whole calendar of events in line with this online portal to bring up sort of new and interesting opportunities to discuss issues at roundtables such as this. Earlier this year, we enjoyed a symposium on creativity in Singapore. So this featured sort of our creative writers from all 4 language streams. It was really very, very sort of interesting, particularly in a multilingual environment, to hear how there are innovations and creativity in the different kinds of languages. Also this year, we also organized with AWARE a roundtable on changing definitions of masculinity and femininity in Singapore. Again, very important issues given the changing roles that men and women play. So now, today, in conjunction with our, so let me get back to this, okay, which is today. In conjunction with our health cluster, we turn our attention to the issue of aging, which is a concern that affects everyone, whether it's personally, in terms of our family members, or society as a whole. And this is a topic that's very much in the news as Singapore confronts the inevitable graying of its population. So according to the last week's report, Aging in the 21st Century by the UN Population Fund and Help Age International, the number of Singapore citizens aged 60 and above will rise from 15.5 today to about 38% of the total population in 2050, right? And the percentage of the population that's estimated to be over 80 years old by the same year, 2050, will be about 13%, and that will rank Singapore as one of the 6th most aged society in the world. So, looking at these statistics, one also thinks of it personally as well. I was wondering, 2050, I'll either hopefully be in heaven or amongst the 13% that's aged more than 80 years old. So obviously this is a topic that I should pay a lot more attention to, even from a personal point of view. I know there are very young ones here. By 2050, you'll still be a babe, but I think for many of us in the room, 2050 would be a time when we will need to perhaps scrutinize these issues on aging in place even further. So, of course, in terms of the societal level, these changes will test Singapore's ability to support increased numbers of the elderly and also to plan it in such a way that we can continue to live healthy, active, and independent lives. Not easy, which is why the kinds of research that we do today to try to address these issues. And in the Faculty of Arts and Social Sciences, many of our colleagues, surprisingly quite a number, when we went around trying to find out who's working in aging, there are actually quite a number working on, for years, on aging-related issues. And particularly this topic of aging in place is something that we thought would be, will strike a chord with many Singaporeans, because it looks at how people age and the choices that they face and in the places where they live and work. So this roundtable brings together several of our colleagues working on aging to share their latest research. Some say their ongoing research because they haven't quite finished, but there will be many opportunities to discuss this research with practitioners as well as policy makers, of which some are here today. The papers, the various sort of presentations will cover long-term care financing, family responsibilities, self-care of older persons, home design, hospice care, home finance, and so forth. So it's indeed a very wide range. Amongst you in the audience, I see specialists also in these areas, and we are very excited to welcome you here so that you could be part of both the exchange that we'll have today, as well as hopefully the follow-through in terms of making sure that these issues are given a wider ventilation, as well as more considerations as far as how it will affect us practically in terms of policy. So our hope is that you will share our enthusiasm for today's roundtable, and that there will be both productive as well as thought-provoking discussions to follow. May I now welcome on stage our esteemed guest of honor, Minister of State for Health and Manpower, Dr. Amy Khor.